There's no place quite like your own home following an illness, injury, or surgery, but when that's not an option, you'll probably want the next best thing. Ryders Health Management are family-owned skilled nursing and rehab centers offering a warm and vibrant atmosphere for residents. Joining me now is the CEO of Ryders, Martin Spriglio, and Barbara Jarman, Director of Social Services and Community Liaison. Welcome, both of you.
Nice to be here.
Martin, tell us the story about this. I understand it was really your parents who started Ryders.
Correct. 60 years ago, my mother graduated becoming a licensed practical nurse and started the company with a lot of foresight, and being a woman, it was very unique back then. And she has quite a work ethic. She still comes to work every day.
Why was it that she thought it was really needed, back then even?
Well, in her training as a nurse, she saw many people that really didn't belong in the hospital and really couldn't go home, and found that the need needed to be fulfilled. And she found the right property in Chester, Connecticut, and started right there.
And you really have 6 facilities. And
yes.
Barbara, you work at the Lord Chamberlain facility. Where is that?
That's in Stratford.
Stratford.
It's a 250-bed facility, and we offer a broad range of services. Our rehab services include physical therapy, occupational therapy, speech and respiratory therapy. We have a wound care program, and we have a lot of support and guidance for families and patients who are looking for a facility.
Now, you yourself you're actually a therapist.
I am.
And are you still a clinician?
I do some work.
You do?
Yes.
And I understand, Martin, you're also a nurse.
Yes, I am.
And are you still on working with patients as well?
I don't. I go into each facility, though, on a regular basis and make rounds and visit with the residents, the patients, and talk to the staff about what the needs are.
You have 6 facilities. Does every facility provide certain types of programs?
Yes. Some facilities are, for example, our facility in Newington has the hydrotherapy, the new Swimex pool, and it's very unique and innovative, and it really helps with improving the rehabilitation potential of the patient.
Well, let's take a look at some of the pictures that we do have. I know we have some of pictures of your facilities. Now, this is where?
Beller Manor, Newington, Connecticut.
How large is this one?
That's 71 capacity with a strong outpatient rehabilitation program.
And Barbara, what's the average stay for most people at these centers?
2 weeks. About 2 weeks.
So basically, this is a bridge from the hospital procedure to getting them back home.
It is. It's good, sound preparation for them to get back to their baseline.
Very good. And take a look at this picture, Martin. What are we looking at there?
We're looking at Lord Chamberlain in Stratford, Connecticut. It's a 250-bed facility.
That's huge.
It is. It is.
Is it your largest one?
It is, and it's a facility that is our flagship, and we have a wonderful team there that has, we discharge almost 1,000 patients a year home at that facility.
Mm-hmm. We have 60 beds dedicated to the short-term subacute unit.
Very good. And here is another facility.
Cheshire House in Waterbury.
That's beautiful.
Thank you. We're actually under construction and going to be installing one of those new Swimex swimming pools.
Now, this is that swimming pool you were referring
to
earlier, and this is used for what?
It's used for improving the rehabilitation potential of the patient who may not be full weight bearing and have weakness, and through that pool we can adjust the resistance and improve the capacity of their muscle strength and bone strength and get them home.
And this is one of your therapy rooms?
Right. This is the therapy room at Beller Manor in Newington, and it's also utilized for outpatient rehabilitation.
So you have all kinds of equipment there?
Yes, enormous. Amounts of equipment from new steps and treatment tables and other resistance programs.
What's unique about your approach?
Well, I think our uniqueness is that being a family organization, we have learned through the 60 years and we continue to evolve. We're very hands-on as the owners, and our staff know that we're there. And we are a family organization, including everyone, the staff, the family. We're there every day.
What advice do you have for people who are now looking to choose a rehab center?
I think it's important for patients who are planning for their own rehab and families who might be planning for a loved one to come see the facility, see the environment, see the staff, see the type of equipment that's going to be used. I think that speaks volumes in terms of making a decision. And Lord Chamberlain is certainly right there with all of the the equipment, it's brought healthcare up to a new level of excellence in terms of their delivery of service.
And they should also perhaps talk to some of the people who are already getting the type of treatments that they are seeking.
I think that's a great idea.
Yes.
Martin, what advice do you have?
My advice is, if you have the opportunity, go see the facility. And the geographic location may be important to you when you have family and loved ones that want to come see you. You don't want to feel isolated.
Very good. If you want more information about Ryders Health Management and their 6 facilities, you can contact them in Stratford. All the information is right there on the screen, or you can come to our website and click on Connecticut Style. Martin, Barbara, thank you so much for